So, I'd like to thank the Crohn's and Colitis Foundation for having me here to talk with you today, but also really for being so flexible and transitioning to a new format because we're all in this sort of unprecedented, challenging time, but it's still a value to be able to learn from each other. And I appreciate everyone's efforts to be here today in whatever form we can. So, I have the job, following Dr. Essers, of talking to you about the adult gastroenterologist perspective of transition, because really this is not just a pediatric problem. Transition is a time that requires multiple stakeholders, and that includes patients, families, pediatric teams, adult teams, and all of us play a crucial role in the success of the transition process. And it will be of no surprise for anyone to hear that as humans, we resist change. But transition to adulthood is one of those things that cannot be avoided or prevented. We can, however, work together to make it a positive experience for everybody involved. So let's first think a little bit about what transition actually is. And I chose this cartoon because I feel like it represents the transition problem very well. First, on the right, we have this emerging adult. This is someone who's going from adolescence into young adulthood, and during that time of your life, you might be going through flux of different things, including geographical location, your social situation, your financial situation, and you often still have some degree of dependence on your caregivers, but you're working towards independence. And what transition really is giving this emerging adult the tools and the confidence that they need to be their independent advocate. In other words, to independently manage their healthcare condition successfully. And the transition is really the process of acquiring those skills leading up to the transfer to an adult GI clinic. There's 10 million youth in the United States who have chronic healthcare needs. So the American Academy of Pediatrics has identified this transition process from pediatric care to adult care as a priority. But there's still a lot of questions about how can we do this safely and most effectively. And the reason why this is a question is that several different studies have shown that this time of transition is a challenging time in the management of chronic healthcare conditions. So many of these studies are taken from other chronic conditions. For example, in diabetes, during transition, the control of blood sugar is more erratic. Or in transitioning emerging adults who have had an organ transplant, their risk of having failure of that transplant is higher during this time. There's increased loss to follow-up, in other words, missed clinic visits or missed refills of medications. And specifically in inflammatory bowel disease patients, there's a study showing that these patients have fewer clinic visits and less compliance with their medications. And actually, other studies show that about 50% of emerging adults lack important knowledge about their medical history, and less than 50% can accurately list their medications and doses. So we have a long ways to improve this time. So what are some of the obstacles that challenge the successful transition? And you can probably imagine what several of them might be. This study took 6 focus groups, and that included patients, families, and pediatric providers. And they asked them, what do you think are the obstacles, or what are your concerns about the transition process? Some of them were worried about the quality of care that they would get and how that would compare from the pediatric setting to the adult setting. Others were worried that because they've been so involved in the patient's care, that may have inhibited the development of the patient's self-management skills. There were many with concerns about finances and insurance and how that process would go. And not surprisingly, many were worried about losing a highly valued pediatric relationship. And I think that concern really cannot be underestimated, because as I see patients and families transferring from my pediatric colleagues, I can really see the relationship that's been built up. When you have a chronic condition and you've gone through both trials and triumphs with the pediatric providers, it can become very difficult to then imagine building that trustful relationship with a new provider and knowing that you'll have the same relationship that you've experienced thus far. I chose this definition of transition because I believe that it really highlights some of the things that we should be striving for through this process. And that is, transition is a patient-centered process that seeks to maximize quality, developmentally appropriate healthcare services that continue uninterrupted as the individual moves from adolescence to adulthood. Highlighting the things that I appreciate was patient-centered. So each person goes through transition in an individual fashion, and we need to meet people where they are, and rather than having them on a set time clock, having them transitioning at the time that they're best able to manage their healthcare condition. We want to maximize the quality care and continue on meeting evidence-based guidelines of taking care of someone with inflammatory bowel disease, but also through developmentally appropriate milestones that these young emerging adults are reaching. And finally, continuing uninterrupted so that we don't have missed medications, missed appointment, or missed studies. So transition really is, it's really two things. Transition does not mean the time that you go meet a new adult provider. Transition really means everything that leads up to that. It's really the exchange of responsibility for healthcare decision making that passes from guardians or parents or families to the patient as they become an adult. And at that same time, that patient is transferring from the pediatric clinic to the adult provider, and that's kind of the culmination of this transition process. And so if you think of it as a gradient of responsibilities that gradually pass from family to patient, and then ending with sort of transfer, which would be just the planned movement of patient and their medical records from the pediatric clinic to the adult clinic. Then this group, back in 2014, identified ways that we can start that process. And it really starts at a young age. In the preteen ages, 11 to 13, is a time that you can start talking about things like, what is my GI condition? What medications do I take? What are the doses? What might the side effects be? They can start to learn strategies to effectively take their medicine. And maybe that means, what time of day do I take it? How do I remember to take it each day? Even how do I take injectable medications, and starting the process of learning how to inject themselves. Teaching them how to use a thermometer. Learning to be able to articulate how inflammatory bowel disease affects their daily life. And this will be important because as they start going to appointments alone, it's good for them to be able to advocate for themselves of what their daily impact is from their disease. When you get into the early teen years, 14 to 16 roughly, start to think about naming who your medical team is, what tests you might be going through, and why you're going through those tests. Knowing more of your medical history, for example, what surgeries you've had and when. Being involved in inflammatory bowel disease support groups can be helpful during the teen years. Understanding why you take your medicines and what happens if doses are missed. And it's important to start discussing how smoking, drugs, alcohol could impact your disease or impact the medications that you take for your disease. When you start to get into the late teen years, start to think about more resources for how the patient can gather information about inflammatory bowel disease. Calling the clinic yourself to book appointments, and calling the pharmacy yourself to fill prescriptions. knowing what your insurance plan is and carrying that card with you so that you have it available when you need it. And then finally, again, this age is different for everyone, but once you have a good grasp of medical knowledge and knowledge of your history and confidence, that's the time to start thinking about what adult provider in my community might be a good fit for me, and starting to schedule those appointments while working with your pediatric team to identify someone that they think would be a good fit. Really, the best time to do this is when your disease is stable. And the reason is because then you can spend that first appointment or first few appointments just getting comfortable with each other, meeting each other, learning about your new caregiver's philosophy, rather than trying to treat or manage a crisis that's come up. So the question is always, how do I know when I am ready to transition or transfer to an adult clinic? And often people say this is really, many factors go into this. One big major factor is medical knowledge. And that means I know what my history is, I know what medications I take, I know what happens if I'm smoking and I have Crohn's disease. And really, I think one of the key points I would like you to take away from this topic is from this talk is that knowledge is power. And when you're transitioning, just gaining knowledge gives you more self-confidence in being able to manage inflammatory bowel disease. And so I just put this screenshot of the Crohn's and Colitis Foundation website. And I put this up because I know firsthand what kind of scrutiny goes into everything that gets posted on this website. And so whenever I'm giving someone recommendations on the internet of where to gather information about inflammatory bowel disease, this is where I send people. This particular site I chose is called Just Like Me. I chose that because it's aimed more towards teens living with inflammatory bowel disease. And there are different support groups available, but it also has information about just day-to-day things like dating, playing sports. Some of the other factors you think about would be health literacy. For example, what different medical tests are and what different results might mean, what your insurance coverage is. Then you think also about self-management. In other words, I can schedule my visits, I can take my medications on time. I know that smoking increases problems with Crohn's disease. And then finally, self-efficacy, which is just the patient's belief that they're able to care for themselves and able to advocate for themselves. And I think this quote, one of the greatest gifts you can give your children are roots of responsibility and the wings of independence. And that is not what Dennis Waitley had in mind when he said this, but transition is exactly that, is that what we're trying to build up in our emerging adults is responsibility regarding their chronic health condition, and also the self-confidence to be able to step forward and be their healthcare advocate. So again, of course, research has tried to figure out, okay, so how do I measure whether I'm ready or not to transition? And they came up with this Transition Readiness Assessment Questionnaire, TRAQ. And this is a 20-question validated survey. That the idea is that if you can pass this with 90%, a 90% pass rate, then you are ready to transition. And it asks questions like, do you fill a prescription when you need to? Do you take your medications correctly? Do you call the doctor about unusual changes in your health? Can you fill out the medical history form yourself? Can you tell the doctor or nurse what you are feeling? Do you help to plan or prepare meals at home? And people can answer, no, I don't know how, all the way up to, yes, I always do this, and everything in between. Now, some studies have pointed out that this may not be the most realistic way to measure readiness, because this one group in 2019 gave this questionnaire to young adults and found that only about 5% of them were able to say as a 90% pass rate that they did all of these things all of the time. But in my mind, I think this is a kind of a jump off tool or a discussion tool. It can help identify strengths and weaknesses among emerging adults and give you an idea of what things to work on next. So we've talked a lot so far about what patients and families can do to make transition go smoothly. Then the next question is, okay, as a healthcare system, what can we do to help your transition go more smoothly? And if I look for evidence to say, how can I make this transition go well? Unfortunately, I don't find much. There are not many randomized controlled trials to say what leads to the safest transition from a pediatric to an adult GI clinic. However, there are experts who kind of give an ideal or give situations that would help improve or ease this transition. One would be disease-specific education programs, which is kind of what you're here today for, really. Having a nurse coordinator who can help communicate with both the pediatric and the adult clinic and make sure that transition goes smoothly. There is a lot written about joint pediatric and adult clinics where the two providers are together. I feel very fortunate where I work is that we have both pediatric and adult providers available. So we are able to have joint clinic visits during that transition visit. And I do think that it makes this handoff feel much more smooth, both from the provider perspective, but also I think from the patient and family perspective when Dr. Essers and I are together in the same room and we're all sort of agreeing about what the next steps are going to be. However, I recognize that many clinics don't have pediatric and adult providers in the same clinic, and so another suggestion would be alternating with pediatric and adult visits to make sure that you're comfortable with moving ahead with the adult provider that you've chosen. Many experts also recommend having peer support groups as people go through this time to make sure they understand any hurdles and how to get through them. But if we really want transition to be patient-centered, then we need to hear also from patients and families what they think is important. And so again, this study was taken from those 6 focus groups where they had patients, families, and providers. They asked them, what practical suggestions do you have to make this go well? And here are some of the most common things that were suggested. One was have some time where patients are in clinic visits alone so that they're able to speak for themselves. 2 would be to hold adolescents more accountable for their care to make sure that they are responsible for taking their medications. The parents said, teach us how to let go, but also to support our children. In other words, give our children wings of independence. Provide us with more information about the transfer process and also what adult providers are in the community and who might be a good fit for me. Let us hear from those who have been through this process before. And be deadline driven when it comes to that transfer, but actually do it during a time when the disease is stable. So I think so far really the keys to transition success, the advice I would give to someone who's transitioning from pediatric to adult care, one would be preparation. Don't wait till the last minute. You can start in the pre-teen years of just education, just small bits at a time, teaching about the disease, teaching about the medications, and then as you reach that transfer process, start writing down questions or issues that you're having so that they're ready for you during the adult visit. Number 2 is self-empowerment, which I think even as adult patients, we can still work on this ourselves, that it's important to feel comfortable speaking up for yourself and being your own healthcare advocate. And if you don't understand something your doctor is providing, don't be shy about asking for a clarification. Know your own story and whatever important changes have come with it. And also to be comfortable and recognize the importance of talking to your new providers about difficult situations such as sexuality or drug or alcohol use. And then finally, it's the decision-making process and feeling confident in participating in making the decision on your treatment plan. And finally, also the decision about what adult provider you see. It's okay to not stay with the first adult provider that you see, because the important part about this relationship is that you find someone that you feel like you click with and that you have a trustful relationship that you think you can build with that person. I think briefly at the transfer visit, in other words, when you first go to meet your new adult provider, it's nice to have a medical summary. And actually, building this medical summary can be part of your transition process. In other words, I like to know when someone was diagnosed, where their disease has typically been, and how severe it has been, what surgeries or complications they've had so far. It's very important to know what medications you're on now, but also what medications you've been on in the past. Especially with biologic medicines, we want to know what you've already tried and why you stopped those medicines. It's important to know your most recent procedure, colonoscopy, or imaging results and the dates of when those were, and what immunizations you're up to date on or what you might need. It's good to know your prescription and your insurance health coverage, especially if we need to get anything authorized. To have a calendar for future appointments or other tests that need to be scheduled. And then to have a list of health contacts, which could include your pharmacy and your primary care provider, anyone else you want involved in the communication of these visits. I included this My IBD website because I do think it gives a really good framework for creating this medical summary. It's available also in an app form, but they're just forms that you can go through and write down all the things I just described. When I was diagnosed, what medicines I've been on. They also have different learning tools on this website. And so it's a nice resource to be able to both build general knowledge about inflammatory bowel disease, but also build your summary of your individual disease. And finally, kind of advice I would give other adult GI providers or take to heart myself would be that there are inherent differences, as Dr. Essers just laid out for us, between pediatric clinics and adult clinics. And it's important to be aware of that emerging adult patient and that they're coming from a very different system than our system, and to educate them about what some of those differences might be and how to navigate the adult system. It's very important to speak with and collaborate with the pediatric gastroenterologist that the patient is coming from. Anticipate that there will be questions from the patient. They will often have family members that are there with them, and the first appointments may take longer than a typical adult patient appointment may take. And then finally, thinking about adolescent neurodevelopment and where that patient may be in their neurodevelopment process and their ability to take responsibility and advocacy for their own health care. So, in summary, we all transition to adulthood. However, this time of transition carries a lot more weight for those who have chronic healthcare conditions. But the key to success, in my view of transition, is that we want to build the skills of knowledge and also confidence and independence so that our teens can emerge as adults with the self-confidence necessary to be their own healthcare advocates.